I was burned June 26th of 2007. I was in the oil field and a piece of equipment I was relighting had ignited. The building went up in flames. I was burned 87%, third and fourth degree. I was in a medical induced coma for 7 months. When I woke up from the coma, I tried to give my mom a hug, but I couldn't lift my arms. The most I could do was push the nurse's call button. There's a reason I'm still here. Why would you not use that to benefit patients in the hospital? Sometimes I feel like I got more out of the visit than they did. With me standing there, they can put a face to that story.
Having the burn survivors come in is extremely helpful for our students. They learn something very unique from the survivors. They bring a life to the care that they received when they are in the hospital, and then they provide that experience to the students. And the students then can take that with them to their practice.
If you really want to do something, you're going to find a way to do it. People will amaze you.
It is so important for us to know what motivates you as a patient to get better. For me as a nurse, I want you to have the best lab values and I want you to feel good and I want you to be out of pain, but how can I help you to help yourself to get better? So learning that from a patient themselves is the great opportunity that we were provided with today.
I try to tell new burn nursing students is to not to judge the patients. They're survivors. They're all in there for a reason because they got burned. I got burned in a hash oil fire. I judge myself much harder than anybody judged me here at the hospital. So for me, it's a blessing in disguise because I met a lot of people and I get to come talk to nurses and about my accident, and they say it helps them.
With everything I went through, it'd be a waste for me not to share my story and my experience. It's the least I could do for the hospital and the nursing staff and the doctors.
They saved my life, so if I can come back and give them a little bit of my time, I will, no matter what.